The thought of human brain surgery existing prior to any type of anaesthetic is terrifying, let alone the lack of precision implements or antibiotics to prevent infection. My guess is that not many individuals would have survived this ordeal. However, there is archaeological evidence around the world of complex and life-saving brain surgery having been practiced thousands of years ago. Thousands of skulls of men, women and children bearing signs of trepanation have been unearthed at archaeological sites across the world. Trepanation is a surgical procedure that involves making a hole in the skull of a living person by either drilling, cutting or scraping away layers of bone with a sharp implement. The astonishing fact about the use of this drastic procedure in prehistoric times is not just its complexity and a high success rate, but also that it was used throughout the world in different cultures, places and time periods with no known connection to one another. Let's delve a bit deeper into this fascinating and gruesome practice to see how 6 ancient cultures operated on people's skulls. Number 6. A sickly mound, Turkey. A 9,500-year-old skeleton discovered in Cappadocia, Turkey, is thought to show the world's earliest example of brain surgery. Archaeological excavations in the 11,000-year-old settlement of the Azikli Mound in Cappadocia have revealed the skeleton of a woman aged around 25 years who had been buried with her baby. Her skull showed signs of having undergone trepanation, with the boring of a hole through the bone. In this case, the tool used was made from obsidian, a locally sourced stone. It appears that the woman had lived for about 10 days after the surgery. Number 5. Stone Age Europe. Archaeologists have uncovered Neolithic skeletons with neat holes drilled into their skulls from all over Europe, in France, Austria, Poland, Spain and Britain. A Neolithic burial site in France indicates that trepanation may have been a common practice. Of 120 prehistoric skulls found, 40 had trepanation holes, many patients appearing to have survived. More than 1,500 Stone-Age trepan skulls have been unearthed from around the world, including China and the Americas. In the past, a flintstone would have been used as the key surgical instrument. In prehistoric times, trepanation may have been performed on individuals who were thought to be behaving strangely, or used as a ritual as part of an initiation rite, or to channel spirits in or out of the body to release evil spirits. The piece of bone extracted was often worn as a charm in order to keep away those spirits. Trepanation was also used as emergency treatment for a head wound, common in hunter-gatherer times to remove shattered bits of bone from a fractured skull and drain pooling blood from the brain. Migraines and epileptic seizures were other medical reasons for use of the procedure to relieve pressure on the brain. Number 4. Prehistoric Russia. A prehistoric burial site near Rostov-on-Don in southern Russia has been unearthed to reveal 35 skeletons from the Copper Age, 5,000 to 7,000 years ago. Anthropologist Elena Betieva and others located 13 skulls from this era, which shows trepanation for likely ritual reasons, as their owners appeared to have been completely healthy. The procedures were all the more unusual and dangerous because they were performed on the ordeal point of the skull, where the brain's main outgoing veins are located. However, healing around the holes shows that most of the patients seem to have survived for a long time after the surgery. While the reason for brain surgery on healthy individuals remains a mystery, another researcher, Maria Mintenkova, believes that these highly risky trepanations were performed to enable so-called transformation for these people, enabling them to acquire superpowers. Number 3. Pre-Columbian America. Trepanation is known to have been practiced in Andean or pre-Inca cultures with increasing success rates over time. There is evidence that over 1,500 years ago, in small mountain communities of Peru, trepanation was used to treat warriors' head wounds and other medical problems. Highly skilled Inca healers scraped or cut a hunk of bone out of a person's head to find and treat the wound site. The expert surgeons avoided cutting cranial muscles or vulnerable parts of the skull and managed not to damage internal blood vessels or the membrane encasing the brain. Skulls found by anthropologists have shown up to 7 trepanation holes, and that infections or death of the patients was rare. Inca surgeons' success rate has been found to be twice that of doctors during the American Civil War, thousands of years later. It is unknown how the ancient Peruvian practitioners prevented infection or what they used for anaesthetic, possibly cocoa leaves or a fermented beverage. The instruments used to create these incisions have not been found in archaeological excavations and also remains a mystery. There is also a dark side to this pre-Columbian practice. A large archaeological dig in an 8,000-year-old settlement at Mont Alban, Mexico, has examined the burial sites of 10 low-status individuals, probably prisoners of war. It was found that trepanation was performed experimentally on these people, trying out different sized burr holes and techniques until their deaths. It is known that there was at that time a toxic political culture in Mont Alban which displayed sculptures of its mutilated torture victims. Number 2. Ancient Greece. A skull found in excavations of the 5,000-year-old and now extinct Minoan civilization on the island of Crete in Greece shows the healed marks of surgery. The fact that this patient survived indicates the remarkable level of skill and medical knowledge of the ancient Greeks. Greek archaeologists have also unearthed evidence of what they believe was brain surgery performed nearly 1,800 years ago on a young woman. Her skeleton was found in a grave at a dig in Veria near Thessalonica in 2008. The woman's skull reveals a case of complicated surgery which only a trained and specialised doctor could have undertaken. She is surmised to have been up to 25 years old and had suffered a severe blow to the crown of her head. The operation was apparently an attempt to save her life. However, she appears to have died during or shortly after the surgery. At that stage of history, Greece was part of the Roman Empire, and brain surgery is known to have been carried out by the Romans. Some textual sources give detailed instructions, and precise instruments were known to have been used. Number 1. Ancient China. A significant number of trepan Chinese skulls has been unearthed, indicating that successful primitive cranial surgery was performed in China over 3,000 years ago. Medical and historical works from Chinese literature indicate that trepanation was likely performed for both therapeutic and spiritual reasons. One theory is that it was sometimes performed on corpses in order to obtain bone discs to ward off demons. Archaeological evidence shows that many living patients appear to have survived for months and years, but the practice declined, possibly due to Confucian beliefs, which became popular that the body was sacred and shouldn't be mutilated in life or death. There was also a story wherein a Han dynasty leader called upon the famous doctor Hui Tuo to treat him for a headache. Hui Tuo, now revered as the father of Chinese surgery, took the man's pulse and diagnosed a brain tumour, with trepanation as the best option. The suspicious warlord had Hui Tuo executed for attempted assassination, and all of his medical notes were destroyed, depriving posterity of his knowledge and experience.